Friends, today we will discuss cholera and Vibrio cholerae. The points to be discussed are general characters of Vibrio, classification of Vibrio, pathogenesis of cholera, clinical manifestations of cholera, epidemiology of cholera, and prevention. Vibrio is a gram-negative bacilli. So typically, it is comma-shaped bacillus having a single flagellum. They are actively motile organism and their motility is described as a darting motility. They are oxidase positive. Their growth is enhanced in presence of a salt and they are typically seen in marine environments. The important species of Vibrio is Vibrio cholerae, which is responsible for the disease cholera. Now we discuss about the classification which was proposed by Gardner and Venkatraman. The Vibrio species are classified into two groups. One is Vibrio cholerae and other is other Vibrio species. Vibrio cholerae is further divided into serogroup or serover based on O antigen. So they are O1, O139 and the third group is non-O1 or O139. There are several Vibrio species included in this group. Now, O1 Vibrio cholerae is further classified into two biotype groups, that is classical and Altor. This classification is based on biochemical characteristic. Both these species, that is Vibrio cholerae O1 group, are further classified into three serotypes, that is Ogawa, Inaba, and Hikojima. Pathogenesis. Vibrio cholerae is responsible for the disease cholera, and the route of transmission is oral fecal. The infective dose is pretty high, that is 10 to the power 8 organisms. Gastric acidity is one of the barriers which prevents the development of cholera or inhibits the pathogenesis. But this organism has got certain factors which can counter the gastric acidity. One is motility and second, certain enzymes which Vibrio cholerae possess. Another important factor is adhesion via pilus or cilia, and this is also called as toxin co-regulated pilus. The most important pathogenetic factor is toxin. Vibrio cholerae produces cholera toxin, and that is a type of enterotoxin. So now we discuss about cholera toxin. You can see over here the cholera toxin is typically AB model of toxin where A stands for active and B stands for binding. So there are two units which are there. With the help of B subunit, they bind with ganglioside receptor on intestinal cell. And once that binding happens, the active subunit goes inside the cell and then it binds with G protein. And this binding with the G protein leads to changes in G protein and later on it activates adenylate cyclase. Activation of this adenylate cyclase leads to a long-term production of cyclic AMP from ATP. So there is an excessive production of cyclic AMP, which in turn leads to activation of protein kinase, and this protein kinase activation leads to secretion of chloride ion. Now what happens over here along with that is that cyclic AMP and this protein kinase has got two effects. One, over here you can see there is an active secretion of chlorine, along with there is an inhibition of sodium uptake. So both of this will lead to sodium chloride accumulation in intestinal lumen, which increases the osmotic balance, or there is an imbalance which is created. And to counter this osmotic imbalance, there is a passage of water from the cell, intestinal cells, to the lumen, which leads to the main clinical manifestation of cholera, that is diarrhea. So next is clinical manifestations. The cholera in clinical manifestation ranges from asymptomatic to severe and fatal disease. The 75% of persons infected are asymptomatic, while in 20% it will produce a mild diarrhea, while in 5% it can lead to cholera gravis, that is severe and fatal complication. The incubation period is pretty short, that is 24 to 48 hours, and this would manifest it by a diarrhea. When we talk about diarrhea in cholera, it is painless, watery, and voluminous. The stool of a patient suffering from cholera is watery along with the mucus flakes, which gives a typical appearance of rice water. Remember that dehydration, which is happening because of this diarrhea, is the terminal complication. Right? So, water loss and electrolyte loss would lead to complication if not treated. You can see over here the patient over here in upper picture, right? So cholera is an acute diarrheal disease that can in matter of hours result in profound, rapidly progressive dehydration and death if left untreated. And with the treatment, at least 99% would survive. You can see in this both figure, there is an excessive loss of the fluid, and this is a severe diarrhea. So dehydration is very important feature or clinical sign which we need to look into. So dehydration can be categorized into three categories: mild, moderate, and severe. The mild dehydration, in which there is less than 5% of body weight loss, which is manifested by thirst. The moderate, 5 to 10% of body weight loss, which is manifested by postural hypotension, weakness, tachycardia, or decrease in skin turgor. The severe dehydration, over here, there is more than 10% of body weight loss, and the complications are hypovolemic shock, renal failure, unconsciousness. So if not treated, the patient would die. You can see over here in this figure a child lying on cholera bed, showing typical signs of severe dehydration from cholera. The patient has shrunken eyes, lethargic appearance, the poor skin turgor, but the moment you replenish the fluid, either orally or intravenously, the patient would become alright. So the same patient within 2 hours after fluid therapy was sitting up, alert, and eating normally. Epidemiology. The cholera is a sporadic, endemic, epidemic, and pandemic disease. Homeland of cholera was the Delta region, Ganga and Brahmaputra, that is in India and Bangladesh. You can see over here, the cholera can lead to pandemics, and till now there are 1, 2, 3, 4, 5, and 6 pandemics which has been caused and which has originated from Bengal, India. And the 7th pandemic was originated from Sulawesi, Indonesia. So till now, world has suffered from 7 pandemics. If you look at the strain which is responsible for this pandemic, you can see over here the first 6 pandemic, it was caused by the classical strain of the Vibrio cholerae. And the 7th pandemic strain, as I said, it is caused by Altor. The name has derived from Altor quarantine station, from where this species was isolated. So this strain has caused the 7th pandemic starting from 1960. But when this pandemic started, and after some years, you can see over here from 60 onwards, 1990, and suddenly there was one more strain which was identified as O139. So it was not from O1 species Vibrio cholerae. This is another one, that is O139. And it was assumed that this would lead to the 8th pandemic. But somehow the Altor once again came back with wave 2 and wave 3, and once again it has now covered the whole world, limiting O139 to some endemic foci in India and Bangladesh. So currently in the world, the Altor strain is prevalent and the 7th pandemic is ongoing. The prevention. Approximately there are 3 million cases and 1 lakh death. This is an estimation because this disease is very much underreported, and the reported number is 2 lakh cases worldwide with 5,000 deaths. The prevention is very important, and the vaccine which is available is oral cholera vaccine. It is a kill whole cell Vibrio serogroup O1 and O139 vaccine. There is a single dose vial containing 1.5 ml of liquid vaccine which is to be taken orally. The vaccine has to be maintained in cold chain, and it is recommended for all above 1 year of age. There are 2 doses to be taken and 2 weeks apart. It would give a protection up to 3 years, and the efficacy of vaccine is 58%. Thank you very much. Once again, in a part 2, we'll have a look at laboratory diagnosis of cholera. Thank you very much.